Hey everybody, my name's Devin Bree and I'm with the New Student Programs and Orientation. I'm one of the student coordinators here at Bentley and I will be helping to set up and run the orientation this year. Thank you for coming to this Falcon live chat about student well-being. And a reminder that this recording will be posted on YouTube in like an hour after we finish recording it. So feel free to check that out. Feel free to spread that message, and the link will be posted in multiple places should you need it. With that, we can get started with our presentation.
Good afternoon, everybody. My name is Jessica Greer-Trawa. I'm the Director of Community Wellbeing and Health Promotion. We're really glad to have you joining us today for our live chat to talk a little bit about the Centers for Health, Counseling, and Wellbeing. Next slide. So we'll go ahead and introduce ourselves, and then we'll get into the content.
Hi, I'm Julia Matthews. I'm the Director of the Health Center at Bentley. I'm a nurse practitioner and public health experienced person, and I go by she, her, hers. So happy to be welcoming you to Bentley.
Hey everyone, my name is Dr. Peter Forkner. I'm the Director of the Counseling Center here at Bentley. I've been here at Bentley for, I think, almost 12 years now, and really looking forward to telling you a little bit more about our center.
And as I said, my name is Jessica Greer-Trawa. We can go to the next slide. So we're here together to talk about our offices, and it's important for us to share that we work in a coordinated and collaborative care model. So each of our teams has a different lens and scope of practice, but we really all work together to ensure that all of our students' needs are met. Some of the things that our offices offer include direct clinical services, prevention-focused initiatives. We do a lot of work on policy and infrastructure. We also do a lot of work on supporting student resilience, and ultimately we're creating a foundation of balance and a co-curricular experience that encourages a lot of ethical decision-making and social accountability. Next slide. So inclusion and quality improvement are continuous processes for our office. And so before we wanted to talk about what we do to support your students, we wanted to share a little bit more of how we espouse these values. And so for you to know, as new students and caregivers, our departments each have annual social justice and racial development goals. We're all trained in trauma-informed care, allyship, and participate in continuous education so that we're developing cross-cultural competencies and prepared to provide affirmative care for a variety of identities and needs. We also are strong advocates for services and resources for our students so that we know that we are doing the best we can to support our students while they're at Bentley. We ensure that our web and referral resources are reflective of the identities of our community members. We're reviewing our policies, programs, and procedures annually, and we are doing continuous assessment to ensure that our services and spaces are safe, welcoming, accessible, and our students are feeling valued and heard when they are utilizing our services. I'm now going to turn it over to Julia, who's going to talk to you about our health center.
Thanks so much, Jessica. Again, my name is Julia Matthews. I'm the Director of the Health Center. I've been at Bentley for about 6 years. And again, I just want to really welcome all our new students to the campus. I think it's going to be an amazing year. We've come through a lot. I know everybody has over the last couple of years with COVID, and we're just so excited to be really ramping up our services and are really ready to welcome students to campus in the next few weeks. Thanks, Devin. Next slide. So by the end of the presentation, I hope you'll understand a little bit more about what services we have available at the health center, who we are, and then I just want to make sure that people understand they can always reach out to us by email, by phone. There are certainly health requirements to complete, and I'll review those, but it's always nice to be able to get someone on the phone or by email, so definitely feel free to do that. Well, let me just start off by saying we are a nurse practitioner-led health center. We are accredited by the ambulatory healthcare centers, and that's a very, it's a wonderful piece that keeps our quality care very high, and there are only a few student health centers in Massachusetts that have that designation. So we're very proud of that. We have a total of 7 nurse practitioners, including myself and our assistant director. We also have a nurse immunization coordinator that helps students become compliant with all our routine immunizations that are we follow all the regulations of Massachusetts, which really helps keep our campus safe. We also have a physician consultant that I'll say a little bit more about as well. So students can come to the health center, they wake up not feeling great, they can call up or they can go on our portal, make an appointment. We diagnose and treat many common health conditions from, regular sore throats to I hurt my ankle playing basketball last night. We also are trained in responding to sexual violence. We are ramping up our services for gender affirming care. As part of services, we can perform lab testing for diagnoses that we make, or if students' primary care send them for lab testing, we can have that done at the health center for them. We do lots of point of care testing, so you can really think of us like an urgent care center, but we try to really promote continuous and care that students can come back to us and get to know us so that we can be their primary care away from home. And we are very good at collaborating with primary care providers. Last semester, we launched express testing for sexually transmitted infections. It was very successful, and we will continue that. We also organize immunization clinics. Our first one will be on September 1st. We try to organize that with one of the biggest move-in days for newer students, and that is one of the days this year. And then those immunization clinics will continue throughout the fall, mostly focused on flu prevention. We also, as nurse practitioners, people are like, what's the difference between NPs and MDs and physician assistants? Nurse practitioners are really good at health education. We really try to meet students where they are, meet our patients where they are. So when you come in as a freshman, maybe you don't know a lot about healthcare or what your needs are, but we really try to educate students and empower them so that when they graduate, they're good, they're consumers of healthcare. They know how to advocate for themselves, know what kind of routine care they should be getting, and how to take care of themselves. We're able to write prescriptions, and we have an excellent medication delivery system that people from Massachusetts may already know about, capsule pharmacy. We write those prescriptions, and with some contact with the student, they can have prescriptions delivered right to their door, which is super helpful, particularly for freshmen who typically don't have a car on campus. We also are able to connect students to specialty care. If there's an injury that they need to go see an orthopedist, or something that's not getting better and they need to see an ear, nose, throat specialist, we can get them connected to that type of care as well, off campus. So our staff and services are available for all full-time students, regardless of whether they have insurance or not. Appointments, typically if a student wakes up in the morning, students sometimes wake up at 2 p.m. and that might be hard to see them before the end of the day, and we can always direct them to urgent care and other resources, but student calls in the morning, they're going to get seen that day. And if they don't get seen, if we're really overwhelmed, sometimes in the fall, there's a lot of respiratory illness or things going on that can keep us very busy, but they'll always get a call back. They'll always get guidance from our health center. We also have implemented an after-hours nurse advice line over this last year, and students have really appreciated it. So when we are closed in the evenings and on the weekends, they can call and just get some of that guidance that they might need that would prevent a visit to the emergency room or urgent care, or they will get advised to access care if needed. And then, of course, University Police, we partner closely with. They're a wonderful resource, and they're always available for emergency concerns. Thanks, Devin. Just want to make sure that our confidentiality policy is front and center. No information is shared unless the student gives their consent. As long as they're 18 years and older, they need to give that consent under. They would need to sign a form that we can provide their care. We also, any approval would need to be given, and that would only be exceptions if in cases of danger to self or others. So just to be clear, student information is confidential, and we'd like to make sure that students update their emergency contact information so we can get in touch with parents, guardians, and family contact as needed. So office visits, what will a student expect? They'll walk in, they will be asked for an insurance card, but it is not charged for the visit. The visit to the health center is covered by tuition, but we do ask for that insurance information, which again is a good habit for students to get into. So when they are seeking care outside of the health center and when they leave Bentley and move forward, because if we do labs or send off any other lab work or other testing, that would be charged to insurance. And all of the coverage is, we have the Blue Cross Blue Shield health insurance, and those type of labs are covered by that insurance. Prescriptions, typically like you would just find at home, are a copay based on your health insurance. And immunizations, when they go to the clinics that we set up, they can provide their insurance card. They can get a receipt for that, get it submitted. Any immunizations that are done as part of a visit to the health center, let's say someone has a wound, laceration, a cut or something, and we have to give them a tetanus shot, that's just covered by the health center. Thanks, Devin. Our hours, 8:30 to 4, Monday through Friday. As I mentioned, we have an after hours care line. We also refer often to the Waltham walk-in, which is associated with Newton Wellesley Hospital. And as I mentioned, we have a physician consultant, and that physician is actually based at the Waltham walk-in. So we really are confident about our care with Dr. Ehrlich, because he sees a lot of what we see in the health center, very student focused. So that's been a great relationship for us. Students are also the local hospitals, for your knowledge, are Mount Auburn Hospital and Newton Wellesley Hospital. And that's typically where we refer students, and it's very close to campus, about 10 minutes from campus. In the case, I know parents sometimes are wondering, how would students get there? If it's an emergency and they are unable to be, if it's an emergency and they aren't stable, they would go by ambulance. If they are just needing transport and don't have it, University Police will often bring them. And then of course with Ubers, friends on campus, those are other options to getting to care.
Sorry to jump in. If you have questions, you can put them in the Q&A and we'll get to them as soon as we see them.
Thanks. Next one. So our student health insurance, it is required in Massachusetts for all full-time students to have insurance. International students are required to enroll in our student Blue Cross Blue Shield plan. It's an excellent plan. We negotiate that plan every year, make sure it's meeting the needs of our students. Students are pre-billed every year and can waive if they're able to provide proof of other comparable insurance. So if your student's already on their parents' plan and that is working for them, that is what they can show, and they do not need to sign up for that insurance. If you are signing up for the insurance, that needs to be by August 2nd. You can see the cost there is $2,337 for 12 months. There's no deductible. There's co-pays for any off-campus visits, $50 for emergency room visits, and then co-pays for prescriptions are, as noted there, $15, $30, $50, depending on generic versus brand and which tier they are. Next slide. We also do have dental and vision. Those are optional insurance. Again, the university health plans, we worked with them for many years, and there's a lot of great information on that website. We'll put the website up again, and all that information is available through the Bentley Health Center website too. There's also tuition insurance, so reimbursement of tuition paid, and that information, again, I won't linger too long on there. Those links are excellent sources of information, but we want to make sure students have all of those options. Next slide. In terms of immunizations, so if you haven't submitted your immunizations, they were due June 15th, but don't feel bad, you still have time, and we are happy to help you with any questions that you have, but please do get that information into us. The required immunizations, nothing's going to look very unfamiliar to you here. It's what your primary care provider has been updating for you each year. So you can see the list there: MMR, Tdap, hepatitis B, meningococcal, varicella, COVID. We are requiring COVID vaccine, as we've done throughout the pandemic, to be up to date, which includes a primary series and a booster. We do TB screening. Just you need to fill out a health history form, a TB screening form, and then submit your immunizations. There's a list of required immunizations there. Once you upload that form, you're also required, and sometimes this step is missed by students, so I'll just highlight it. You also are putting each date in for your immunization. And then those immunizations will be verified by our compliance service. We have a partnership with Medicat. They do the compliance piece. And once you submit that information, they will review it, you'll get verified, and you'll know that you're all set within a few days. There's also a list of recommended immunizations. Certainly recommend those, but they are not required. Next slide. This is the health portal. This is where all of this happens. We've tried to make this just very clean, simple. Welcome to Bentley. Here are the requirements. So as you can see, it's a step-by-step process there, completing your health history form, completing your TB questionnaire, uploading your immunization form, and putting in those dates. You can also put your insurance information in there. And we're also allowing students to be able to update their pronouns, gender, preferred name, all of that, so that when they come to the health center, they can feel super comfortable that we know who they are and are ready to provide them services. Any questions about immunizations, you can reach out to the health center, but if it's also something that you've submitted and you have a question about, you can also email the compliance services, and that information, that email address is also on the portal website there. Next slide. COVID-19. COVID is with us. We have moved beyond the acute phase, but I did want to just highlight some of the updates. And please do pay attention to your email. There will be an email coming from the university about what the expectations are for COVID on campus this year. As I mentioned, there is a vaccine requirement, and that's for students, faculty, and staff are required to be up to date per that CDC definition. As I mentioned, it's a primary series plus recommended boosters when eligible. Testing, as you may know from your experience and many other campuses, we were doing screening testing throughout the last couple of years. Screening testing has ended on our campus, as it has on most other campuses that we communicate with locally. We, however, really recommend rapid testing at home before you come to campus. As you know, these tests are available everywhere now. You can order them from your health insurance. You can order them from the government. You can pick them up at your local pharmacy. So do a test before you come. Make it really just a great experience for you. And as I've seen in my personal life, my kids going off to camp, the recommendation is try to do some low risk activities the week before you're going to go to a big event or move on to campus, and then do a rapid test before you come to campus. That's our recommendation. There is no requirement. I just want to make sure that that's clear, but we really do recommend it. And pack some tests with you so that if you wake up one morning and you think, oh, I think it's allergies, but we've all heard the story in our personal lives. It wasn't allergies, it was COVID, and now you've exposed people. So really what we're very happy about, we've had really high vaccination rates on campus, really have kept people safe. And as we know, very luckily with our very healthy young population and highly vaccinated campus, we've not seen severe illness since the beginning of the pandemic. People have had mild illnesses, and COVID, however, as we know, still can disrupt plans and cause a lot of inconvenience in our lives. So we are really trying to step off on the right foot for this semester and reduce the spread of campus as much as possible. So, and in addition, students can get tested at the health center, particularly if they're not feeling well, but otherwise we really are suggesting bringing that rapid test along with you. In terms of masking, personal choice is the plan for masking. It is mandatory in some areas like the health center, and it will also be by request if physical distancing is not possible. So for example, in a classroom or a staff room that you're meeting with. In terms of contact tracing, there'll be lots more information on the website, so I won't linger too long here, but students will submit an online form to let us know if they have tested positive. As I said, the health center would of course be available for care and guidance, but as we have in our personal lives, we're moving to a more independent model so that students would, if they tested positive, would submit a form. In response, they'll get a lot of guidance in an email regarding how to proceed regarding isolation, communicating with their faculty about class, how they can inform their contacts, knowing that there'll be some really robust dining options for them to just grab and go. And in terms of isolation and quarantine, if a student lives close enough that they're able to go home, that would be the best option. If not, they will be isolating in place. So that is different from last year where we were able to still set aside some isolation and quarantine space. Bentley will not be doing that, and most other universities we're in touch with are not doing that. So it's really like having good conversations with roommates to plan ahead. If one of us tests positive, oh, I live close by, I'm gonna go home. I can't go home, so maybe I'll be the one to stay here and you guys go home. So there needs to be some good communication, collaboration with roommates on that, and we're gonna be there to help guide our students. Next slide. So here is some additional advice and resources. There will be, all of our information is being refreshed in the next week or two. As I said, look out for your email. There'll be a link to this website about what all the updates are about COVID. Again, make sure your emergency contact information is up to date, and prepare to be flexible. And we want to make sure everyone can do their part to help keep our community healthy and safe. And also, it is important to be knowledgeable about how your health insurance works. So this is a great time to talk with your parents and students to talk together to say, okay, you live in Massachusetts, your insurance will be covered at the local urgent care. Oh, I'm an out-of-state student. Should I consider signing up for the Blue Cross Blue Shield health insurance so I know what my coverage will be in network and out of network? Next slide. And here is all our health center contact information. Again, we welcome your inquiries at any time and are really excited to welcome you to campus. Any questions that I can answer, I'll be happy to do so. Thanks again for joining us today.
Devin, there's two other sections of the presentation for the counseling center and the other departments. While Devin's getting that set back up, Julia, I noticed that there were some questions in the chat that were really specific for you in the health center. So maybe while Peter's speaking, you can answer those inquiries.
Sure. Let's see. If my child takes a prescription, could I pay for it and have it filled in Waltham, or do I need to mail it? Corrine, I'm going to ask you to send that email to the health center. I think that's going to be easier for us to answer that for you, but depending on what the prescription is and how we can help you with that individually. Insurance. I see another prescription question from Carrie. Can you please send that to the health center email? I think it's very individual and very happy to help you with that. Those are all good questions. I think there's a lot of questions about medication. So again, Lena, I'm going to ask you to email the health center too. And yes, blood testing can be done at the health center. We will do it if we see a diagnosis and are asking for that, and we will also do it with orders from a primary care provider. So again, email the health center and we can get that set up for you. We do not offer physical therapy on campus, but we can refer you and connect you with physical therapy locally. Happy to do that.
So why don't we turn it over to Peter, and maybe Julia, you can just respond to questions by typing as they come in. This way we're able to be stay on time.
Gotcha.
Perfect. Peter, you're muted.
You'd think 2 years into a pandemic, I'd learned to do that, but no. So again, great to talk to you all. My name is Peter Forkner. I'm the director of the Counseling Center here at Bentley. And so I'm going to tell you a little bit about our office, and let's get started. So the Counseling Center is a place where students can come to receive mental health support. Mental health support is a very sort of broad term I like to use, because for some students, mental health support looks like that they're stressed out and they need to talk to somebody. For others, it's that they have ongoing issues, which I'll talk about more in a moment. But Essentially, I want you all to know that the Counseling Center is a place where students, when they're struggling emotionally, they're struggling with stress, they need to talk to somebody in a private, confidential manner, that they can come to our office and make an appointment and speak with one of our staff. We have a staff of a variety of mental health practitioners. Right now, we have 5 licensed psychologists. We have a training program with practicum students who are getting their doctorates in clinical psychology, as well as we're partnering with a telehealth company. So we have a variety of different providers with different kinds of backgrounds and clinical expertise. And so I'm confident that that if your student were struggling and came in to meet with somebody, that we'd be able to sort of meet their needs, certainly if they are short-term in nature. And I'll talk about that more in a second. Next slide. So more specifically about what we offer, we will, the way I like to phrase it is that we want to meet with all students who are experiencing mental health related distress. As I mentioned earlier, that's a very broad term, but I want students to feel comfortable knowing that there's no issue that's too small or too big that we're not going to be able to help them out with. Now, because of sort of our size and our scope of practice, we're only able to provide ongoing short-term treatment for students. So if somebody comes in and it looks like their condition would require more extensive or more serious intervention, we're able to connect them with somebody in the community or refer them to the proper program to make sure that they are able to continue functioning in a positive way for their experience at Bentley. A little bit about our structure. So, you know, students are often like, well, I'm not sure exactly what's going to be like. Who am I going to meet with? What's that first appointment going to look like? And it's important to let your student know that the first appointment, it's just what we call a consultation. You're going to be sitting, you're either going to be sitting down, or maybe you'll be connecting remotely with one of our providers who's just going to get a little sense of what's going on in their life, a little bit of background, a little bit about the history of the problem. And then after that brief appointment, we'll make a recommendation and say, you know what, it makes sense for maybe for you to continue meeting with one of our providers, or maybe you know, I think you'd really benefit from this workshop on how to deal with anxiety and stress. Or maybe we're running a group that would be a good match for that particular issue. But anyways, it's a conversation where somebody who maybe is struggling and they're not sure exactly what to do, they can come in and we'll help them out with that. As I mentioned, you know, if a referral is in the best interest of the student, that's something else we can help out with. We do have a psychiatric provider who we have on staff who's able to, as a part of our partnership with this telehealth company. So if a student has never been on medication before and we are meeting with them, we're saying, you know, this person might benefit from speaking with somebody who has some expertise in medication, and maybe that's the right choice for them, we can make that appointment for them to make sure that they are able to sort of see if that's a good option for them. I want to emphasize, though, however, because we have, this is a resource that we set aside for students who've never been on medication. And so if your student is currently on medication, seeing a psychiatrist, or is receiving any sort of mental health medication from a provider, it's important that you continue that relationship, or if need be, find a resource in the area where they can continue to get that prescription. If that's challenging for you to find somebody in the area, you can call our staff and we'll sort of help you find a provider in the area who will be able to continue that. Next slide. So the most common question I get is, you know, what are the kind of concerns that students come in with? And as I referred to a couple of times, students come in with all sorts of different issues. Most relevant to new students is sort of difficulty adjusting to Bentley. Transitioning to college it's a big deal, and a lot of things come up, whether it's separation from family, separation from friends, finding their place at Bentley, not finding challenges connecting with others. We're certainly available to sort of talk with them and help them strategize ways of feeling more connected. We see students for stress, anxiety, depression, really, you name it. We really sort of liked the staff we have are experts in college mental health. So if your student is experiencing it, I can guarantee you that we're helping other students with the same issue and have in the past. Next slide. So as a result of COVID and for a while, we were sort of limited in terms of seeing students in person. So we really buffered up our online resources. So if your student is not really interested in coming into our office, we have a number of online resources. For instance, we have an anxiety and stress reduction workshop, which it's essentially it's a 4-session class that that a student can take on their own to help them learn about how to deal with anxiety and stress, and that's been very helpful. We're also running something called the Good Vibes series, which Jessica might be talking to you a little bit about, because it's been a great collaboration with her office, where we're really focusing on what we know about positive psychology and about what, not just what helps people who are doing poorly do better, but it's what can we do to emphasize those students who are doing well to help them to thrive. So that's been really helpful. We also have a YouTube channel with videos on all sorts of topics, mental health related. So, you know, if someone's stressed out and they're looking for some a meditation guide or something like that, they can check out our YouTube channel. If you go to the website there, it's easy to find our health resources page. It's also important for me to mention that though the counseling center is open 8:30 to 4:30 Monday through Friday, that we also have an after hours number. So if a student, we recognize that, you know, stress, anxiety, crises don't just happen during the regular day, they happen at night as well. So you could always call that main counseling number, 781-891-2274. If we're open, we're going to have you talk with somebody who's on our staff. If we're not open, you can press a certain prompt that will connect you with our after hours service, and they're able to help whomever with whatever they're going through. Next page. Just like the health center, the cost of coming into the counseling center is part of the cost of tuition. So there's nothing going to be out of pocket. And in our case, we actually don't even take insurance information. So your student shouldn't be worried that there's going to be a bill or that this is going to cost any money. It's also important to emphasize that everything is confidential. This is absolutely something we take very, very seriously, so that students know that they can share things with us that that we're not going to be telling other people at the university. We're not going to be telling their professors without their permission. We're going to be telling their friends. To be honest, we're not going to be sharing it with parents unless they've given us permission to do so. Now, you know, I should, just to sort of relieve any sort of concerns, if there was ever a case where somebody health and safety was a concern, or if a student needed to go to the hospital, that is something in which that parents would become aware of. But certainly in all cases, we try as hard as possible to make sure that we maintain strict confidentiality to make sure the students feel comfortable talking to us. And it's important, obviously, to emphasize that the counseling records are not a part of a university record. It's very separate. So students don't have to worry that this is going to somehow come up in a, you know, as a part of their transcript or something like that. Next. As I mentioned, 8:30 to 4:30 Monday through Friday. Just remember that number, 781-891-2274. This semester, you know, as Julia had mentioned, we because our providers are licensed by the Division of Professional Licensure, that the Massachusetts Department of Public Health requires that we wear masks when we meet with students, which has been challenging in that most of what happens in therapy is being able to read people's expressions. And so we found that to be really hampers the treatment process. So so for the past 2 years, we've been seeing all students remotely. This year, we will allow for students to come in person and be able to meet with one of our providers with a mask on. But we found that the results and the satisfaction of students who have been seen with remotely exceed previous years when we were seeing people in person without masks. And so we know that that seeing people without masks, even if it's remotely, is in many ways superior to be able to then meeting with somebody with a mask on. And so while we will allow students to come into our space and meet with our providers in person, we're going to be encouraging people to go remote and we'll have space available if that's the case. But certainly that's a conversation we will continue to have with students as they come in. And that's pretty much it, I believe. There's my contact information. Don't hesitate to call or email if you have questions or concerns, and look forward to chatting with you.
Thank you, Peter. And finally, I'm going to tell you a bit about the Office of Community Wellbeing and Health Promotion. And we are actually co-located with our colleagues in the Counseling Center in the same building on the second floor, located just above University Police. So if you've been to campus or if you've reviewed a map of campus, we are pretty close to most of the residential rooms that a lot of our first year students will be residing in. Next slide, Devin. So our department serves more like the ambassador to our clinical teams. We are the ones that are coordinating a lot of the co-curricular education and outreach programs and services for students. And so we're a smaller team. We have currently 2 professionals in the office. So in addition to myself, I have another staff member who has their master's in public health. We also take a graduate student intern, and we also have between 10 and 12 peer educators. So those are undergraduate and graduate students who are trained specifically to deliver content and provide information and serve as valuable resources, from that peer-to-peer level. So ultimately, we're using public health frameworks, and we're providing programs and services to get at all the things that get in the way of academic success in that co-curricular experience on campus. Next slide. So some of those things, some of those focus areas that we know get in the way, sleep. Sleep is one of the biggest challenges that I think students struggle with as they're adjusting to college life. And one of the things that a lot of students will put on the back burner and not prioritize. And so we do a lot of work around that. We also do a lot of work around substance use prevention and response. A lot of our content focuses on relationships, communication skills, setting healthy boundaries with individuals, with time. We do a lot of work for safer sex and sexual health promotion, and then we do also non-clinical work around stress and anxiety and building resiliency. So as you can see on this slide, there's just some photos from different events that we've put together on campus over the past few years. Next slide. So just to kind of show a little bit of the breadth and depth of the programs that we offer, Peter mentioned a few minutes ago the Good Vibes series, which focus on evidence-based positive psychology principles, things like you might have heard in the media of practicing gratitude, or just doing some mindfulness exercises. And so we have developed 14 or so different activities, and we have different worksheets that are stored on the Counseling Center website, but we also run a challenge throughout the year with students. And so we encourage students to sign up. It's self-paced. We provide them with the materials. And this is just to show, this past spring, we ran a challenge for 6 weeks, and we on average had about 85 students who were logging in each week, but we also had a lot more students who participated but didn't necessarily log their experiences. Falcon is a new program that was piloted by our graduate assistant this past academic year, and it's basically a delivery kit of safer sex supplies or sexual health information that students can request. And so we piloted it last April. We had 150 students who collected kits, and we are going to be continuing that program so that we're increasing access to this information and supplies throughout the year. And then bringing in the bystander program is a training that we run with students that basically teaches students, builds confidence and competency in stepping in and taking action, encouraging help-seeking behaviors when another student is, his personal health or safety is in danger. And so this past year alone, we trained over 450 students in that. Next slide. This is just a quote I wanted to share. I think it really describes the co-curricular enrichment. This is a student participant from the Good Vibes Challenge this past spring. And the student just shared that their participation in the challenges showed them the importance in taking care of both their physical and mental health and how those should be prioritized more often. Next slide. So in addition to programming and outreach, we actually do provide some direct services, and this is where we do a lot of the collaborative and coordinated work with our colleagues in health and counseling. So we do offer, health coaching on topics like sleep, stress management, study skills. Oftentimes when students come in for those types of appointments, we're getting a big macro assessment in terms of what's going on, and sometimes that student is experiencing more specific medical or emotional well-being concern, and we're able to be that conduit and that point of facilitation for connecting them with a service provider or a care provider who can assist them, more specifically with their needs. We also do a lot of work around harm reduction education for alcohol, marijuana. If your student happens to find themselves being documented for a policy violation through our student conduct system for alcohol or marijuana, chances are they're going to be referred to our office, and we would be meeting with the student to essentially identify, like, okay, what are the things that are going well? What are the things that are not going well? If you're experiencing some significant challenges from your choices, let's work at implementing some strategies so that these things are not getting in the way of your success here at Bentley. And then we also do cessation support and counseling for nicotine use. So we do see students who who are vaping consistently and trying to cut back, more so than students who are using traditional tobacco products, but we will work with them, and if indicated, we can refer them to our colleagues in the health center who can work with students as well in conjunction with our office on cessation. Similar to the Health and Counseling Center, our staff are confidential. We're not confidential by licensure, we're confidential by policy, which means that our, Bentley wants our space to be a safe space for students to come forward and share if they have any concerns, so that again, we can be sure to get them connected with the best care and resources and support for them. Next slide. As I mentioned, we also have two peer education teams. One team called the RSVPs, they are our relationship and sexual violence prevention educators. We also have a team called the Wellbeing educators, and those students are more generalists, and they focus on things like sleep, stress management, self-care, and lower risk substance use. I share this if you're a student that's viewing this live chat, or if you are a caregiver of a student who is engaged in peer education at the high school level before, please reach out to us. These are paid student leadership positions on campus, and we're always looking for students who have these more nuanced skill sets to join our team. Next slide. Just like the health center, there are some pre-arrival requirements that our department manages. More specifically, these are mentioned in the new student transition guide. There are some required online learning courses that focus on alcohol and other drugs education, healthy relationships and interpersonal violence prevention, and diversity, inclusion, and belonging. We will be launching these courses on August 8th. And the courses are due before students arrive. And so we will communicate this information through the Bentley email. We know that not all of our students are good at checking their email, so we're sharing this with you so that you know that the information and the specific login is a single sign-on process, so that link is going to the student's email address once those courses are live. If for some reason you know that this time frame for when these courses are due are not going to work out for your student, or your student knows this because they're traveling or there's something else going on, it's best to contact us as soon as possible so that we can make note of that and work with your student for an alternate deadline. The reason that we are pretty stringent is that these courses help us meet federal requirements for education for our students before they come on campus. Thank you. Next slide. So Peter talked a few minutes ago about adjustment and how adjustment to college can take some time. And so I just wanted to point out a few things, especially if this is your first student who's heading off to college, or recognizing that some of our students are first in their families to be attending college. So we want to just make sure that we're priming you with what to expect. And the first thing is that there's going to be highs and lows of your students' first semester, sometimes first year. And so please expect that you're going to be hearing some really, really positive things, and then you're going to be, potentially talking with your student, and maybe they're feeling a little bit down. That's normal, but also please don't hesitate to reinforce it, encouraging them to come and speak with us, because we do meet with students all the time to talk about like these adjustment pieces. Please be realistic with your expectations for success and setbacks, and help your students set realistic expectations. We know that social media, TV, streaming shows have one picture of what college life is like. And again, you've probably heard this before, but we need to reinforce that that might not be reflective of every student's experience. And those are really well curated pieces of information and content that people put out there. So please make sure that we are reinforcing that that's not necessarily realistic. Encourage your students to disconnect from devices. Sometimes it's really helpful to kind of put your phones away, put your computers away, and actually get to know other individuals. Get outside. We've got this lovely suburban campus. There's hiking trails across the way. Just making sure that your student is taking the time for themselves, normalizing failure, and then encouraging involvement. Time after time, we hear new students and their families talking about how they just encourage their students to focus on their academics their first semester and don't get involved in too many clubs or activities. And we just want to share that actually getting involved via either student employment or a leadership role, a club sport or intramural, or some kind of club or activity is actually a really strong predictor of successful adjustment and feeling connected and engaged with campus. A lot of the times when I'm meeting with students who are struggling, they don't have any other identity outside of their classes. And so, we just want to make sure that you're aware that the data and the science actually show that it's important to have that balance and have that co-curricular experience while they're on campus. Next slide. And then finally, it's really important for you as caregivers to have some productive conversations before your student heads off to school. Having a conversation around healthy substance use and patterns, talking about what healthy amounts of consumption are for alcohol, what healthy frequency of use is, some of these harm reduction techniques is really important. Again, we have data that shows that students whose families have these conversations actually fare better academically and make healthier choices and associate with peers who make healthier choices around substance use. Also talk to your student about consent and boundaries, their personal space and time, how to ask consent, how to navigate conversations, what are some of those verbals and nonverbals. Consent doesn't necessarily always have to come in play with interpersonal relationships or dating relationships. Sometimes consent comes in play with whether you want to borrow a shirt from your roommate, or whether it's okay to leave the lights on late while you're studying and your roommate is trying to go to sleep. These are really important topics, and it comes up a lot. Sexual health and safer sex. Julia talked a little bit about the clinical care that can be provided and that we have access to the Express STI clinic on campus. Regardless of your students' choices, we have information and content to be able to support them. We can speak to them about supplies. As I mentioned, the Falcon program provides point of access to students, and also talking about, positive norms. Again, sleep comes up very consistently. So talking to your student about what their sleep needs are, setting a consistent schedule, what are some of the things that might get in the way of good sleep. And then lastly, having a plan for managing stress, talking to your student about what does it look like when they get overwhelmed? How does it feel in their body? And what are ways that they can de-stress on campus? And if you'd like to learn more about options for that, our team is always available to speak with students to help identify those strategies. Next slide. So we have a pretty robust Instagram account. So as caregivers or as new students, one way that you can stay posted and understand, what's happening in our office and what types of our offices and what types of services or programs are available is to follow our Instagram account. So there's our information here, and we also have a wealth of information online. So if you go to our website, there are a variety of different apps. There's different support groups and call centers. There's workshops, videos, a lot of different things that your students can access so that they can learn and practice some information, from the comfort of their room. So just a couple of reminders as we're wrapping things up. Julia had mentioned that the immunizations are now due. Please continue to send them in. As a reminder as well, you'll need to enroll and waive the student health insurance plan by August 2nd. The required online courses that I mentioned a few moments ago, those are going to be launching on August 8th. Please reach out to any of our teams if you have any questions or if there's ways that we can support you, and you can follow along on Instagram to see what's happening on campus. Next. And here's my contact information. So there's my direct email address, and then our general office contact information. And again, you should have access to this after the webinar is over. And I think that's it for now. You know, we're welcome to field any questions you all have for any of our offices. We really appreciate you following along with us this afternoon.
Yep, we definitely have a few more minutes left in this webinar. So if anybody has any questions, feel free to ask them in the Q&A. If there are no questions, feel free to log off. But remember that this will be posted on YouTube. I believe it's under the Welcome Falcons page. So if you look that up with student well-being, it should be there within the next hour or so. If you want to look back for deadlines or dates, but feel free to ask any questions. We'll stay on for a couple more minutes.
You're welcome. Thank you for joining. I'm responding live when I'm supposed to.
Alrighty, that looks like it may be it. So I'm going to end it here. Thanks everybody for coming. Thanks for doing this. It looked really good. Appreciate it.
Bye, everyone.